Broadcast is now starting. All attendees are in listen-only mode.
Good afternoon and welcome to Reproaction's Act and Learn webinar for the month of November 2021. Today's topic is reproductive health and U.S. foreign aid. First, we'll introduce your hosts. The first voice you're hearing is Erin Matson. I use she, her pronouns. I am co-founder and executive director of Reproaction. I'm based in Washington, D.C., and I encourage you to follow me on Twitter at Erin to the Max.
And I'm Shireen Shakori, Deputy Director of Reproaction. I'm also in DC and I use she, her pronouns. You can follow me on Twitter if you like at sheermean.
Fabulous. So let's take a look at today's agenda. We'll introduce Reproaction. Then Shireen will talk us through U.S. foreign aid, international development, and public health. We'll do a panel discussion, and we're very excited to have the experts joining us today. We're joined by Siri May from the Center for Reproductive Rights, Elena Sarvar from the Global Justice Center, and Andrea Gillespie, Andrea, from American Jewish World Services. Then we'll cover next steps and do Q&A. So a note about Q&A. So if you have any questions, you don't have to hold them until the end. Just put them into the questions tab and we'll get to as many as possible at the end. So let's talk about Reproaction. We lead bold direct action to increase access to abortion and advance reproductive justice. We're deeply proud of our left flank analysis, and we're known for our willingness to hold folks on all sides of the issues we work on accountable, whether they're traditionally considered allies or opposition. And we have a deep commitment to nonviolent direct action as one of the tools in our toolbox. And with that, I will pass it to Shireen.
Yeah, so the topic of international development and foreign aid could definitely move past the confines of this 1-hour webinar, but I want to give a brief history of where like the modern concept and practice of it came from and how it's impacted what we see today. So like I said, the modern theory of international development traces back to the post-World War II era, where the global south was viewed as less equipped and thus more primitive than Western nations, which were largely able to rebound from the devastating war within like 5 to 10 years. And the notion was that with a boost from the West, these nations could have the same economic resiliency and high living standards, but the problem is this was rooted in a kind of West is best mindset that was a pretty direct carryover from and an extension of colonialism and imperialism that had kind of shaped the conditions in the nations that were being scrutinized. And we'll definitely cover more of that in a bit. But this period is generally where you get the outdated terms first world, second world, third world. And that came from the presumption that with assistance, nations categorized in the lesser label would rise the ranks, so to speak. And this line of thinking definitely has flaws, mainly that it is impossible to ignore that the wealth of nations came through the colonialism and imperialism at the expense of nations and regions where the resources were exploited. And wanting to foster higher standards of living and provide goods and services, promote human and environmental welfare abroad just comes at that cost. Like you have to ask yourself, the organization you're working in, the movement you're working in, that are local populations bought into this? Does this empower growth and foster dependency? At what point does development aid impose ideas on other people without accounting for their culture and cultural relativism? So like more or less the idea that what's good for one person within their culture may not compute with another person or another culture's preferences, customs, ways of seeing the world, and how they exist in it. You can move to the next slide. So this brings us to something I really wanted to cover in its own slide, the idea of dependency theory, which is the idea that foreign aid, as we've known it for a long time, is kind of a continuation of these colonial and imperialist structures. So basically that foreign aid and the development industry has kept recipient states in the same level of dependence on richer Western states as they had under earlier periods of colonialism. And I just wanted to share this quote from the organization Village Earth, which has a really great breakdown of how that's been put into practice. So rather than maintaining a colony, the US or Britain were now using their economic influence and often clandestine programs to manipulate elections and install puppet governments. Rather than controlling the economies of the South directly from London, Paris, or Washington, these governments of the North were now using the IMF and the World Bank to entrap the South in debt and impose structural adjustments. Rather than taking people as slaves, first world practices were pushing them off their lands and giving them no alternative but to move to overcrowded urban areas, working in sweatshops. So this is a quote that wraps up a lot of things and could be seen as simplistic, but it's provocative, and it gets us thinking about how our nations of the West have moved throughout the world and used other nations and other peoples potentially for their own benefit, while packaging it as a public and international good. Next slide. And I want to briefly touch on sanctions. This is more related to foreign trade. It's viewed as like a punitive measure, and in some cases it applies to foreign aid as well, from usually more resource nations onto usually lesser resource nations that are believed to have violated international law. And these are government to government actions. It's not something, you can't call sanctions something like boycotts or things that are taken individually or as like grassroots movements to divest from a state, but it is an incredibly sharp tool in international affairs, and in many cases they harm the people of the targeted nation more than the government itself. For my part, as an Iranian American, I have seen the harms of sanctions against the Iranian government that keep the top officials sitting pretty while the populace experiences extreme inflation, poverty, and worsened healthcare access. I can say for my own part, I lost a family member in Iran because she couldn't access chemo medication. And medicine and healthcare supplies were usually allegedly exempt from sanctions imposed by Western nations on Iran and other countries, but in reality, non-governmental organizations and corporations that operate abroad usually just get too afraid of the penalties for doing business in a sanctioned nation, so the supply dries up and individual people are hurt or die. The government does not feel these actions, or they just lose access to essentials like diapers, period products, OTC medications, and other day-to-day items because inflation is so high, or the supply stream is, completely emptied. And we know supply chain issues are something we're feeling now. Just imagine other nations that have it imposed on them for decades or more. Next slide, please. So this is my last bit in the intro, and again, there's so much more I could say, but where foreign aid and foreign assistance and international law kind of collides with public health, you see that international aid and international cooperation in healthcare provision, there's more nuance here than the economic levers. If healthcare is a basic human right, which we do believe it to be, it is a moral duty for nations that have generated their wealth on exploitation and on violence to provide healthcare support to those they've harmed and destabilized. And ideally, that aid would come no strings attached, unimposed, and culturally competent, with a deep investment in the community's processes and practices. Otherwise, it's just further imposition of Western beliefs, customs, and in some cases, faith systems. And with that, I want to pass it over to Erin to introduce our next guest, who will explain a bit how US policies have impacted to access to and quality of reproductive health care abroad.
Thank you so much, Shireen, and thank you for sharing your personal story as well. So I'm very pleased to introduce Siri May, who uses she, her pronouns. Siri joined the Center for Reproductive Rights in February in 2019 after leading the United Nations Program for Outright Action International, where she spearheaded the organization's work at the UN General Assembly and the UN Security Council. Prior to this, Siri worked as a senior advisor for the Australian Human Rights Commission, where she led the commission's work on sexual orientation. gender identity, gender expression, and sex characteristics, and was advisor to the Australian Human Rights Commissioner. Before shifting her focus to international human rights, Siri spent a decade working in the Australian HIV and sexual health sector, where she led public education and health promotion initiatives, legislative and policy reform processes, and research partnerships with a focus on key populations. Siri's education includes a Bachelor of Economics and a Bachelor of Social Sciences from the University of Sydney and an LLM in International Human Rights Law at Monash University in Melbourne, Australia. Siri, thank you so much for joining us today.
Hi, thanks for having me.
Yes, it's a pleasure. So I'd like to talk with you about access to reproductive health specifically. Let's start with the Helms Amendment. What is the Helms Amendment and how does it impact access to reproductive health services and abortion worldwide?
The Helms Amendment's actually been in force for nearly 50 years, and it was enacted as a reactionary anti-abortion policy, one of many that took place in the wake of the Supreme Court's decision here in the United States on Roe v. Wade in 1973. And Helms is included now in the annual state and foreign operations appropriations bill, and it prohibits foreign assistance from paying for the performance of abortion as a method of family planning or to motivate or coerce any persons to practice in abortions. So what does this mean in practice? In practice, this means that all US foreign assistance remains unavailable for abortion services, including training and equipment and even abortion information and counseling, meaning that healthcare professionals whose clinics receive funding from the US government are not able to provide care or even help people to find and access the abortion care they need, even if it is legally available in their own country. So a lack of clarity around the implementation of the Helms limits health professionals from providing available services and prevents people from receiving basic health information, which in turn limits their ability to make informed decisions about reproductive services and the abortion that might be right for their individual circumstances or that might best meet their needs. And so by putting access to safe abortion out of reach, the US government is forcing people around the globe to turn to abortion methods that are not safe. And we know that tens and thousands of people die from unsafe abortions and millions more suffer serious injuries and complications that can have lifelong impacts. So Helms and other policies that restrict funding for abortion care exacerbate those poor health outcomes in other countries. And the US government has really treated Helms as a total ban on funding for abortion. But the Biden-Harris administration does have the authority to direct agencies to at least allow funding for abortion in cases of rape, incest, or where the life of the pregnant person is at risk. So it's imperative that they direct agencies to ensure abortion care can be covered in foreign aid, at least at a minimum, under those circumstances.
Yeah, and just a follow-up question on that, Siri. To date, has the Biden administration done anything to suggest they may be taking that action soon?
I mean, I think what we see here are some pretty hopeful signs, sort of both in terms of the newly released National Gender Equity and Equality policy. Sorry, I lost my place there for a moment. And of course, in the memo that preceded that. So we're seeing good signs. I think, we're yet to see it implemented in a real and tangible way on the ground.
Got it. Yeah, and this is truly an urgent matter, and one that the administration should absolutely take action on. In particular, with so much emphasis on abortion rights right now in the United States, also taking a look at our imprint around the world. It does seem it's really unconscionable, I will say, from my perspective, that the administration hasn't made this step already. And it's time for change. My next question is, so a lot of people will get confused. Well, wait a minute, weren't we just talking about the global gag rule? No, we were just talking about the Helms Amendment, which bars abortion funding and U.S. foreign assistance. Can you talk folks through the global gag rule, what that is, and then as a follow-on, what we can do to get rid of both the global gag rule as well as Helms entirely, not just this smaller action that the Biden administration should take immediately?
Sure. I mean, to start off with and to reiterate, the Helms is a congressionally enacted policy, and as I said, it's been enforced for almost 50 years. The global gag rule is a policy that is imposed by the executive branch, and that's been enacted and repealed every 4 to 8 years by Republican and Democratic administrations, respectively, since 1984. So the Helms Amendment applies to all US foreign assistance funding, which means that it impacts both US and non-US NGOs, multilateral organizations and governments who receive foreign aid from the United States. And it dictates whether or not what can or can't be done with those foreign assistance funds. But the global gag rule applies to non-US NGOs, and it largely controls who can receive foreign assistance. And it's worth noting that the global gag rule's impact is not inconsequential. The most recent iteration of the global gag rule was very expansive under Trump, and it applied to all foreign assistance funding, not just family planning and reproductive health funding. So in that context, it actually impacted broader healthcare sectors such as HIV/AIDS, maternal and infant health, and even hygiene and sanitation sectors. And it expanded the policy's reach, or the previous administration did, meaning that NGOs that had no direct relationship with the US government, but that received funding from NGOs that did agree to the policy, also then had to certify that they would comply to the policy, even though they weren't receiving directly funds from the US administration. So that's a really complicated policy in terms of how it's enacted and enforced, and that resulted in a chilling effect, which was extremely dangerous. And the impact of this lasts long beyond the policy's implementation periods, because organizations tend to over-implement a policy like this, and they even go as far as to cut ties with non-certifying organizations out of fear that they'll lose funding. And it takes a monumental amount of outreach and work to rebuild those relationships, rebuild trust in impacted communities, and resume care. And often that simply can't be done. So really, in relation to both Helms and the global gag rule, the US has sort of tied its own hands in terms of meeting its own development goals around improving health and human rights realization for women, girls, and people of diverse sexual orientations and gender identities. And these policies are both incredibly outdated and out of step in terms of what we're actually seeing around the world, and of course, in terms of public health evidence. Globally, countries are tending towards liberalization of their abortion laws, and international human rights law clearly affirms that access to abortion care is a human right, tied to the realization of several other human rights, including the right to life, the right to health, the right to equality, the right to privacy and information, and of course, the right to be free from torture or cruel or inhumane or degrading treatment. So that places US restrictions like Helms and the global gag rule that often worked in tandem, even more sharply out of alignment with global trends and movements of governments and civil society that receive US foreign assistance. And it's really worth noting that this foreign assistance is actually interfering with the sovereignty of other countries' laws. So if they have access to safe abortion mandated under their own legislative environment, the US is imposing a different type of restriction onto those countries, which I think sort of talks a little bit to the introduction of imposition and neo-colonialist ideals in that sense. So, I mean, it also, these policies hinder other countries from meeting their own human rights obligations, however much they might want to do so. And civil society and community health programs often shoulder the burden of outreach and implementation around healthcare programs, especially for rural, low-income, and marginalized communities who use a mix of foreign aid and national funding, and policies like Helms and the global gag rule really hinder governments and NGOs' abilities to be effective. So I guess on a slightly hopeful note, like how do we get rid of it? There is momentum in Congress to permanently repeal the global gag rule and the Helms Amendment through the Global Her Act and the Abortion is Healthcare Everywhere Act, respectively. And as I said, it's extremely helpful to have had the Biden-Harris administration's support around expanding access to sexual reproductive health, including access to safe abortion, outlined in their memorandum protecting women's health, and also in this newly released National Strategy on Gender Equality and Equity, which was only released last month. I mean, really just a matter of 3 weeks ago. So we've yet to see what those initial kind of doorways look like. But in terms of absolute, overturning, we really need to look to Congress to permanently repeal these.
Thank you so much for that. And it is indeed quite welcome to have these steps forward in Congress. So last question for you now, Siri, moving away from oppressive US policies, what international or country-specific litigation, legislation, or constitutional referendums might the Center for Reproductive Rights have its eyes on right now that it could expand abortion access in other countries?
Yeah, it's such a great question. I mean, we are such a large organization, so it was a little bit difficult to narrow down the cases that I wanted to talk about. But I wanted to start off by acknowledging the work on abortion access of my center colleagues here in the States. I think the world is watching an onslaught of attacks on established constitutional rights here, from the horrific SB 8 law in Texas to the pending case in Mississippi, among others. And as many of you know, alongside the US Justice Department, the center was the lead in the oral arguments heard by the Supreme Court in the SB 8 Texas case last week. And of course, we have our upcoming case on Mississippi versus Whole Women's Health scheduled for oral arguments on December 1st. And I think it's really important we situate our work here in the US as a domestic issue, in addition to foreign policy issues. We see our work and litigation here in the States sitting alongside and not separate from work in other regions. And you know, it's that concept of walking together and not having US exceptionalism seen as saving other countries while it battles domestic issues here at home. So I just wanted to kind of acknowledge that that's sort of a large piece of work that the center's working on at the moment. We do similar work across the world, and I just wanted to highlight a couple of countries. The first is in Poland. We have 3 groups of potentially groundbreaking cases challenging Poland's highly restrictive abortion law pending before the European Court of Human Rights. Earlier this year, as many of you might know, a ruling from Poland's constitutional tribunal invalidated as unconstitutional legal access to abortion in situations of severe or fatal fetal impairments. And these cases challenge the impact of this ruling on gestating folks of reproductive age. So they're the first cases to be heard before the court in Europe in over a decade that challenge a prohibition on abortion, and they offer the court an opportunity to bring its case law in line with jurisprudence of UN treaty bodies and find that prohibiting abortion violates the European Convention, especially including the respect for private life and the right to be free from ill treatment. So we've yet to see how that eventuates. These cases generally take a long time. In sort of more pending outcomes in Colombia, we're a week away from knowing a decision of the Constitutional Court based on a lawsuit that the center wrote along with 4 other organizations as part of the Causa Justa movement, which is composed of more than 90 organizations and almost 150 activists throughout the country. And that lawsuit has the potential to eliminate the crime of abortion from the penal code in Colombia, which would mean that it would then be regulated as a right and as a health service. In Nepal, in August, after years of advocacy by the center and its Nepalese-based partners, the government of Nepal has agreed to decriminalize abortion and protect sexual reproductive health rights. And that move came after Nepal's acceptance on July 8th of the report of the working group of the Universal Periodic Review in the UN system in Geneva before the UN Human Rights Council. And then in Africa in June this year, the Malawi High Court reaffirmed the statutory protections for legal abortion under narrow circumstances in a case brought by the center. In this ruling, the court reiterated that despite existing legal restrictions on access to safe and legal abortion on a few sections of the penal code, a different section made an exception where the life and the health of women are in danger. So again, it's a narrow definition around access to abortion, but it's still one that's important. And I'll finish off with at the international level. The center is leading 4 simultaneous lawsuits at the United Nations Human Rights Committee, which is the body of independent experts that monitor the implementation of the International Covenant on Civil and Political Rights. And these cases aim to reform abortion laws in 4 cases across Ecuador, Guatemala, and Nicaragua in a strategy called El Golpe, or the strike. And the purpose of that litigation is not only to provide full and effective remedies for 4 survivors of a human rights violation around sexual violence, but it's also about ensuring that we highlight and denounce the systemic problem of sexual violence in Latin America, that we broaden the standards and norms under the International Covenant on Civil and Political Rights in the context of reproductive health, and that we achieve structural changes to each of the countries involved, and later hopefully across the region, that advance sexual and reproductive health of girls and adolescents, especially regarding abortion services for young victims of sexual violence. And that's it.
That's all, right? Oh,
Just a snapshot.
Yeah, thank you so much for taking the time to join us and our listeners today. This has been quite an education, and thank you for the incredible depth of the work that the Center for Reproductive Rights is doing to advance human rights around the world and in the United States, and securing that right to abortion and expanding abortion access. I want to encourage folks, if you have questions for Siri, just put them in the questions tab. We'll get to as many as possible at the end. And there would be a slight program change. So I was going to pass it to Shireen to do Q&A with Elena. However, I'm going to take that over right now. And I will be doing the questions with Elena, and we'll probably have Shireen back, and she'll do questions with Andrea. So please excuse the photo in the bottom. It's actually me, Erin, still going. So I'm very pleased to introduce Elena Sarver, who is legal advisor at the Global Justice Center, where she uses international law to advance gender equality. Elena's work focuses on ensuring sexual and reproductive health and rights and justice for sexual and gender-based violence. She supports the legal program at Global Justice Center through research, analysis, and advocacy. Elena holds a JD from Benjamin N. Cardozo School of Law, where she participated in the Human Rights and Atrocity Prevention Clinic. And Elena's pronouns are she and her. That's a typo on our end that we didn't put she and her in there, so excuse that. Elena, thank you so much for joining us today.
Great, thanks so much for having me.
Yes, thank you. We're thrilled to have you. Big fans of the Global Justice Center and your work. So let's just dive right in. You've written for Ms. Magazine, specifically an article titled "The Persistent Danger of Trump's Definition of Unalienable Rights." And it highlighted that administration's awful approach to human rights generally and with respect to reproductive health. And I think, just to editorialize for a moment, I think many people don't understand just the grave depths of harm caused during the Trump administration, specifically on reproductive rights, on a whole number of things unseen, as well as what we knew and what was reported in the mainstream media. So recently, Secretary of State Blinken released an addendum to the 2020 human rights reports that included sexual and reproductive health and rights, which should have been there all along. And really appreciate Secretary of State Blinken adding that on. How does it compare to the previous? So how does this administration compare to the previous administration's approach to international sexual and reproductive rights? And what's the effect of this, of having them in place?
Great, thanks so much, Erin. So just to talk a little bit about what happened. So last week, Secretary of State Blinken announced the release of updated country reports on human rights practices with information related to sexual and reproductive health and rights. So these annual country reports were actually released in March, but this was an announcement of the release of addendums to those reports specific to sexual and reproductive health and rights. And in contrast with the previous administration, like you said, there's just a number of ways that the Trump administration really attacked human rights framework and reproductive rights. Just to start, they removed reproductive rights reporting in these country reports from 2017 to 2020. And just to discuss a little bit of the other actions that the previous administration took. With respect to human rights, they withdrew the United States from the Human Rights Council, failed to submit a number of overdue treaty reporting for treaties that the U.S. is a party to, including the Convention Against Torture, and also created a number of harmful groups and policies, including the Commission on Unalienable Rights and the Geneva Consensus Declaration. And with respect to reproductive rights, that also imposed and expanded the global gag rule, which Siri talked about just before me, within days of taking office, and additionally targeted Title X family planning program with new regulations. So there's just so many, it would be tough to cover all here, but so many actions that the Trump administration took that this removal of reproductive rights reporting was really in line with their MO. So I think that it's absolutely an important step to be celebrated, this return of sexual and reproductive rights reporting, and a signal of this administration's commitment. But I would just say that I think my organization, the Global Justice Center, we're often a bit more critical. So I think that just to say that I think adding back in, as important as it is, it's really a return to status quo of what's been done since 2010. And I know that there's recent effort to make this a permanent practice. This past May, I believe it's led by the center. There was a bill introduced in Congress called the Reproductive Rights or Human Rights Act to ensure that the State Department, no matter the administration, is required to report on sexual and reproductive rights in these reports. So I think when we look, when we compare to the Trump administration, this maybe looks radical, but I think that this really needs to be part of, a first step of a concrete strategy of action where human rights like sexual and reproductive health and rights really lead the administration's policy agenda, both at home and abroad. There's been a number of other positive actions with the Biden-Harris administration, the rescindment of the global gag rule and the creation of the Gender Policy Council with its first national strategy on gender equity and equality. Those are incredibly important. But like we talked about earlier, there's still policies in place like the Helms Amendment and Gender Amendment, which don't get as much attention, but they've been in place for decades and they've been causing harm and exporting US values abroad. And just this past cycle of the United States Universal Periodic Review, which is a human rights record review every 5 years, the US received a number of recommendations specific to its restrictions on foreign assistance, including to repeal Helms. So I think the rest of the world is really telling us something about our policies. And the Global Justice Center, along with over 140 organizations, sent a letter to the Biden administration really asking for executive and administrative action in the interim, since these policies require congressional repeal, the Helms Amendment. But in the meantime, there's things that the administration can do, including issuing guidance clarifying that US foreign assistance can be used to support abortion care under Helms and exceptions for rape, life, and incest, since it's often overly interpreted as a total ban on abortion. So I think there's still more work to be done here.
Yeah, strongly agree that there is much more work to be done, and thank you for raising that. So my next question for you, Elena, is, so people may hear about various charters and treaties and reports that go into creating international law and policy and not connect it to the reality that there's people living on the ground who are living that out. So how do US foreign aid policies impact people abroad and their lived experience and the ability of NGOs to do their work in sexual and reproductive health pursuits abroad?
Yeah, absolutely. I think Siri touched on this a bit before too, so I'll be a bit brief in this. But I think that it's important to understand a number of these policies have been in place for decades and causing harm for decades. That Helms Amendment was first introduced after Roe v. Wade was decided in 1973. The Gender Amendment, which restricts US aid from going towards lobbying for or against abortion, has been in place 1981, and the global gag rule, as Siri mentioned, has been on and off since 1984 with a change in administration. So this has really been impacting people's lives and work of non-governmental organizations in these areas in a number of ways. They restrict access to care that people need and are entitled to, including abortion-related services, and that really exacerbates the crisis of unsafe abortion worldwide. There's a limitation on the activities of experts and advocates providing access to and information about abortion services. We've written an extensive brief on how these policies violate the free speech and association rights of healthcare providers and advocates around the world. And there's a chilling effect. These policies are very confusing and vague, and there's often a lack of information and clarity. So there's self-censorship that happens over fear of losing funding, and an over-interpretation, as a blanket ban on abortion services and speech out of a fear of losing funding. And I think that even with the change from administration to administration, it's very challenging for providers to keep up and know what policy is in place and how it applies to them. So I think this is why we really need the sustainable long-term action, repealing these policies and having ultimately protection for abortion as a fundamental human right. And I think just to tie in a bit more to like what these GJC works with this tool of international law and how these US abortion policies violate international law. And we work in these various UN mechanisms like treaty body review processes that the US is a party to or participates in. But I understand that can be, challenging to see the real world impact. I think in the US, there seems to be a disconnect to the application of human rights to American lives. And I think it's often this view that human rights are for people elsewhere, like our Constitution offers us the greatest protections. And unfortunately, what we're seeing play out across the country is abortion. With abortion, it's unfortunately not as strong as maybe we would have hoped. And I think still the United States has to comply with its international human rights commitments because these treaties are binding. And we've seen examples of other countries turning to international law and human rights system in their domestic legislation. Just a few months ago, Mexico's Supreme Court issued a ruling declaring unconstitutional the total criminalization of abortion in one of its states, and they cited directly references to international human rights rules and decisions. So I think this signifies the importance of this human rights framework, not just on paper, but also in lived experiences.
Thank you so much for that. And just to expand a little more on that, in your article, it really gives a sense of that this idea of human rights and how it has been warped by conservatives specifically, while they're still not at the same time looking at the abuses they've caused here and abroad by failing to stand up for true human rights. So how do we create a future in which human rights, including safe and accessible abortion, is treated as a fundamental obligation?
I really appreciate this question. I think it's something our organization thinks about a lot, and we've started to see examples of this in practice too, of not just focusing on defensive responses, but rather putting energy to sustainable long-term protections. As an example, the legislation that we've talked about, repealing harmful policies like Helms or ensuring reproductive rights are part of human rights reporting or permanent repeal of the global gag rule. So I think this can really take a variety, and it needs to take a variety of forms and approaches, whether it be legal or financial, multilateral or social. So I think just to talk about a few of these in more detail, I think it really has to start with respect for the international human rights law framework, which protects abortion as a human right. I think that is, and also, states complying with these legal obligations. This could take, the form too of ratification of human rights treaties, including CEDAW, the Convention on the Elimination of All Forms of Discrimination Against Women, and meaningful commitment and implementation of those human rights obligations. So, and then, financially, I think repealing restrictions on U.S. foreign aid. So what does state and international funding look like to really ensure and explicitly protect universal access to abortion services? And continued engagement with multilateral bodies, Human Rights Council, treaty body reviews, reporting, really, kind of shoring up that accountability, not just for others, but for here at home. And I think this last point is just on this socialization, reframing human rights as for Americans. It's not this exceptionalism or for the other, it's really demanding that we do better both at home and abroad. And really seeing policies like Helms as another side of the coin of policies like Hyde, which blocks federal funds from being used to pay for abortion. So I think that there's just a number of steps that could be taken and need to really ensure that abortion is treated as a fundamental obligation.
Thank you. Thank you so much, Elena, and so appreciate how you tied in what's happening domestically along with what's happening internationally, and the opportunities for the U.S. to do and be better and to stand up and respect human rights and abortion rights. So I want to encourage everyone, if you have questions for Elena, to put them in the questions tab, and wanted to check in with Shireen. Shireen, do you want a Q&A, Andrea?
I think I can make it happen as long as folks can tolerate some annoying dog noises.
All right. Yeah, we welcome Chihuahua input. Reproaction is both pro-abortion and pro-dog. So I'll pass it to Shireen.
Awesome. Thank you so much. Well, I will be introducing Andrea Gillespie, who uses she and her pronouns. Andrea is the policy advisor for sexual health and rights at the American Jewish World Service. She grew up in Ohio and holds a Master of Public Policy and Bachelor of Arts in Political Science and Near Eastern Studies from the University of Michigan. Prior to joining AJWS in 2018, Andrea worked in refugee resettlement and protection in the U.S., most notably as a refugee protection and advocacy fellow at Human Rights First, where she worked on the travel ban case. Andrea completed her Fulbright Fellowship in Turkey from 2015 to 2016. And thank you so much for joining us, Andrea. I'm going to get started with our first question. We heard a little bit about the anti-rights work of previous U.S. foreign policy apparati. But how does domestic policy making impact the rights and healthcare access abroad for LGBTQ people specifically? And what's the current administration doing to hopefully remedy some of those harms?
Thanks so much. And it's such a huge question. I mean, what I think is most important to remember is that when we're talking about all of these attacks that Elena outlined on reproductive rights, that is also inherently linked to attacks on LGBTQI rights. So in the context of the Commission on Unalienable Report on Unalienable Rights, they released a report that deemed abortion and marriage equality as divisive social and political controversies. That was the term that they used, and created a hierarchy of rights within that report. And so many individuals in power in the last administration held both anti-repro and anti-LGBTQI views. So I do think one of the most harmful things was the elevation of a very narrow and misguided interpretation of religious freedom. Under the Trump administration, we saw a huge expansion of this that trickled down into who got money and who was preferenced in programming. And unfortunately, religious freedom arguments can and have been used to deny health services to LGBTQI folks. I think it's important to state too that as a faith-based organization, American Jewish World Service is deeply opposed to the use of religious arguments to justify discrimination against individuals based on their sexual orientation, gender identity or expression, or sex characteristics. But that is what a lot of the policies that the Trump administration put into place allowed. But to be clear, this didn't start under the Trump administration. If we're talking about Congress, PEPFAR, the Bipartisan HIV/AIDS Treatment and Prevention Program, has a huge religious refusal clause in it that allows organizations to deny services and even referrals to LGBTQI folks, which undermines rights and the effectiveness of our global health programs, especially when we think about the fact that men who have sex with men and trans folks are considered key populations and are the very people we need to reach in our fight against HIV due to their higher risk of HIV infection. PEPFAR also has two other really concerning policies that impact LGBTQI rights. One is the PEPFAR abstinence only requirement. And as you all know, abstinence only and be faithful programming is often heteronormative and deeply discriminatory to those in the LGBTQI community. Yet it is still promoted within our global health programs, and that limits really necessary information for individuals about healthcare. And the second is the anti-prostitution loyalty oath, which conflates consensual sex work and sex trafficking in a way that further stigmatizes sex workers. As many LGBTQI folks face obstacles to formal employment sectors, especially trans people, sex work is often a source of income, and this policy has really limited engagement in healthcare for this population and thereby undermined global health programming and access and put sex workers at greater risk of not being able to have healthcare. So when we think about that, the Biden administration has inherited not only all of the harms of the last administration, which we might not even know what they are, and the Biden administration might still be uncovering some, but they're also inheriting a legacy of US global health programs, specifically not supporting the health and rights of folks around the world, and really having some policies that impact the very ways in which they can access services. So I think on the bright side, though, the Biden administration really is looking at this. Obviously for LGBTQI rights, one of the biggest actions we saw was that President Biden signed a presidential memorandum in February, which really recommitted the administration to the fight for global LGBTQI rights. The memorandum covers a lot of ground, everything from multilateral engagement to refugee and asylum to foreign assistance. But crucially, it required agencies to do a review of policies that have been detrimental to LGBTQI rights and really seek to resolve those. That alone is a monumental undertaking, but also such a necessary step. And we have heard that not only is foreign assistance bubbling to the top, because as a spoiler alert, LGBTQI rights are highly underfunded, but also issues around non-discrimination keep appearing in a lot of the work that they are seeing. And it will be really great to finally see what comes out of that review. And both Siri and Elena mentioned the White House Gender Policy Council releasing the first ever national gender strategy, and LGBTQI rights were elevated throughout the document. The document specifically includes a recognition that the United States should be leveraging all of the tools necessary to reform laws that discriminate against LGBTQI people, including in healthcare. And of course, I cannot forget that President Biden rescinded the harmful global gag rule as one of his first actions in office, because that policy was disastrous for health and rights of LGBTQI people around the world.
Yes, and that will actually lead into our next question. But first, I really do appreciate what you had to say about religious refusal and kind of the imposition of supposedly faith-based programming, because we know that to very clearly be a religious minority in the US that is making policies worldwide and domestically that are set on a certain level of faith standards that are presumed to be that something that all should believe in, and a lifestyle choice that is not usually compatible with our own day-to-day lives. So I really appreciate you lifting that up. But back to the global gag rule, along with targeting abortion access, which is an LGBTQI issue, how was that an attack on LGBTQI people abroad?
Yeah, I love this question. And I, again, think it is so important to remember that the rights of LGBTQI folks are intersectional and so integral to the fight for sexual and reproductive health and rights. In the context of LGBTQI health access, not all health clinics are friendly, welcoming, or gender affirming. And it can take a very long time for a community to feel safe when seeking out healthcare services, especially in countries where being LGBTQI is criminalized. And often the clinics that are safe spaces are also the ones that are providing the full range, including abortion services. So when the global gag rule comes in, it forces clinics to choose between funding and providing comprehensive information, services, and referrals for abortions. And this hits the most marginalized populations who already struggle to access care. So not only did the expanded global gag rule cut off services like abortion for LBQ women, gender nonconforming, and trans individuals who may want and need abortions in their life, but it also filtered out a broad swath of other essential and life-saving healthcare services. And this is especially true for HIV treatment and prevention. So, for example, Amodefa is a national family planning organization in Mozambique and one of the only organizations in the country that was providing LGBTQI perspectives in HIV services. When they refused to sign the global gag rule, they lost 60% of their funding and were forced to close clinics across the country, which really reduced the availability of safe services for those in the LGBTQI community. And that is not the only example that we have. The State Department's own review of the policy conducted under the Trump administration and other civil society organization research has also documented HIV service disruptions for key populations, which again, as a reminder, includes men who have sex with men and trans folks. And we have also seen reports of LGBTQI organizations refusing funding because of the global gag rule. And this comes in a context where LGBTQI civil society organizations are desperately underfunded The large majority of organizations have budgets of less than $50,000 and even $10,000. And donor governments, out of every $100 spent on foreign assistance, only 4 cents goes to LGBTQI rights. So when we are taking funding away from LGBTQI-led organizations, we are undermining the work, the sustainability, and the advocacy efforts that those organizations are doing on the ground. So though the global gag rule is rescinded, healthcare doesn't just pop back up. It really takes time to reopen clinics, to rehire staff, and frankly, rebuild trust with the LGBTQI community that might have lost services. So the global gag rule really is one of the most damaging policies that the US can have for LGBTQI rights. It essentially builds what I like to think of as a fence on top of a great wall of an already existing barrier to healthcare services for those in the LGBTQI community.
Yeah, I think a lot of people who don't necessarily work adjacent to Repro kind of saw that the gag rule was rescinded and were just like, great, flip the switch, snap back, everything works again. But to your point, so much of the infrastructure to provide that care really was lost, and building it back is definitely going to be an ongoing process. So what can we in the US do to push elected officials to prioritize improving safety, equity, and healthcare access for LGBTQI people worldwide, and hopefully not make these continued snapbacks every 4 to 8 years the word of the day?
Yeah, this is my dream right now, and one of the most urgent things that everyone can do is to call their elected officials and ask them to prioritize permanent repeal of the global gag rule, because it is urgent and it is possible. This is the first time in decades that we have to end this heinous policy once and for all, so that we don't have this political football if a future administration comes in. And Representative Barbara Lee and a bipartisan group of senators, Senators Shaheen, Collins, and Murkowski, have long been champions of permanent repeal of the global gag rule. And we really want to see a final appropriations bill this year that has permanent repeal of the global gag rule included. So that is first and foremost one of the most important, and do it today, do it tomorrow, do it every day until there is a funding bill, actions that listeners can take. And the second one is, while you're on the phone with your elected officials telling them to permanently repeal the global gag rule, you can also ask them to co-sponsor the Greater Leadership Overseas for the Benefit of Equality, also known as the GLOBE Act, because Congress loves an acronym. And that bill is led by Senators Markey, Shaheen, and Merkley in the Senate, and Representative Titus in the House. And the legislation really is a vision bill for what inclusive global health programs look like for LGBTQI individuals. So not only does it recognize the impacts of the global gag rule on LGBTQI folks, but it also ends that those whole host of anti-LGBTQI, anti-repro policies I talked about in PEPFAR, whether that's ending religious refusals, ending abstinence-only requirements, or ending the anti-prostitution loyalty oath. So demanding permanent repeal of the global gag rule now and co-sponsoring the GLOBE Act are two huge steps elected officials can take today to promote LGBTQI rights around the world in the future.
That is so, so great. And we like to end this on an action-inspiring note. So thank you so much. And thanks to all the rest of our panelists. I will kick it back to Erin for next steps, I believe. Or maybe I'm doing next steps. We'll see. Yes, I am. Okay, you can plug into Reproaction campaigns. Sign up for our alerts at reproaction.org, where you can get our emails so you don't miss a thing. And then on social media, anywhere you can find us, it's at Reproaction.
Thank you. And please save the date for our final Act and Learn webinar of the year. It will take place on Wednesday, December 8th at 1 Eastern. And our topic will be 2021, a year in action. And you'll be hearing from the members of our team their favorite action of the year. So with that, I will open it up to questions. If you have any questions for our panelists, please put them in the chat box, or not, excuse me, not the chat box, in the questions tab, and I'll answer those. So one question, is there a recording? So yes, there is a recording, and we will be sending out the link by email, and then we'll also be putting it on our website within the next few days. So thank you so much for your interest in that. And hold the space a little for another minute or so and see if we get any other questions to come in. While we wait for that to come in, I'd love to open it up to our panelists. I believe it was Siri who made mention to the fact that at a time when many countries are moving to increase access to abortion under the law, the United States is moving in the opposite direction. Would just love to open it as an open forum for panelists. What do you make of that? And the fact that the United States seems to be against the global tide?
I can have a go, maybe as a non-American. I think one of the issues that we're looking at, and I guess, the other panelists have pointed to this, in such a clear and articulate way, that when we talk about access to abortion and liberalization globally, we're not just talking about access to abortion as a separate issue. We're talking about sort of a general response to international human rights. And the US does have a long history of exceptionalism around being seen as an equal player in the international human rights system, including not signing, over 50% of the international human rights treaties available, unlike many other countries. And I think that in many ways, the sort of polarization that we've seen for the last 50 years around the Helms Amendment, so the global gag, sort of bouncing between administrations, talks to, I guess in some ways a shared opposition, which is really about control of the bodies of women and LGBTI folk both. And I think that there was a real attempt to try and export a lot of those evangelical values overseas. In countries like Africa, we saw, regions like Africa, we saw lots of, introduced legislation that actually started to criminalize same-sex behavior between men exported from the US. And when those initiatives were not successful, it came back to the US in its domestic reform. I think these are the same actors, the same sort of what we would call opposition, that have a vested interest in maintaining patriarchal control over bodies. And I think that's playing out right now in the US. And I think that the US sits in a broader kind of global context. The global trend towards liberalization is a trend, but there are, of course, exceptions such as the one in Poland that I've spoken about recently as well. And, I think there's also a rise in ethno-nationalism and authoritarianism. And I think that those things are often coupled with attacks on bodily autonomy for women and LGBTI folk. And so in some ways, I think the US is out of step domestically with other countries. And in some ways, it's actually in step with countries like Poland and Russia and others that have more regressive regimes attached to authoritarian and misogynist or toxic masculinity driven regimes. I don't know what other panelists think about that.
Yeah, I would absolutely agree. I was just going to note briefly that we, the Global Justice Center, filed an amicus in the Mississippi case, along with Human Rights Watch and Amnesty International, that just touches on just briefly this point about how countries across the world are moving in the trend of allowing abortion on broad grounds. Overwhelmingly developed economies make abortion widely accessible, and it's really a small percentage of countries that prohibit abortion altogether. So I think that part of that argument is how abortion bans like Mississippi's really are an unmistakable step towards this minority position. But I definitely agree with what Siri mentioned about the ties and the overlaps with authoritarianism, and seeing that play out in a number of countries around the world.
Thank you. Yes, and I also want to highlight on our own website at reproaction.org, on our blog, our own senior outreach producer, Ivania Woods, did a piece about the connection between democracy and abortion rights, and specifically how the anti-abortion movement is inherently an anti-democratic, small d democracy, anti-democracy movement. We are just out of time. I really want to thank our panelists, Siri, Elena, and Andrea. Thank you so much for joining our audience today and for sharing your expertise and your impressive work towards human rights around the globe, expanding access to abortion care. And thank you deeply to Shireen Shakori, our Deputy Director, who pulled together and visioned this incredible and powerful presentation. So thank you to everyone. Have a great weekend, and we will see you in the streets. Goodbye.